Ready.
So I'm gonna do Trache Care. So first I'm gonna sanitize my hands and put on my gloves. So I'm gonna do insertion of the trach tube as well as cleaning and care of the tube, and then a trach change and weaning. So first I'm gonna do insertion. I have the tube with the obturator in, but yeah. First I'm just gonna stick the tube in and remove the obturator, and then put in the inner cannula, and then I will secure the tube. Make sure that's tight enough, and then I will put the gauze underneath. Alright, so that's insertion, and then I'll move on to Trache Care. So that's going to include changing the holder, changing the gauze, and cleaning around the tube. The holder, the gauze, and the cleaning around the tube is done every shift and as needed, based off how much sputum they produce and how much secretions they have. So first I'm going to change the gauze. So I'm just going to take this one off, and I will use a swab with hydrogen peroxide and sterile water on it to clean around the tube and around the stoma area. And then I will replace the gauze and replace the holder. So I'm going to replace the holder first. So just make sure you keep a hold on the tube so that it doesn't go anywhere and accidentally decannulate. And I'm going to replace the gauze, the clean one. And then this inner cannula is a reusable one, so I'm going to take it out and use this little instrument with sterile water and hydrogen peroxide as well and clean it. And then I will rinse it with sterile water and reinsert it and connect the patient back to the vent to ventilate. So then for the weaning process, the first thing I would do is switch to a fenestrated tube. So I would, or inner cannula I mean, and take the inner cannula out and then put the fenestrated one in. This allows for the patient to speak over the tube. And then after they've tolerated the fenestrated tube, I will switch to a speaking valve. Once they've tolerated the speaking valve, then you switch to a tracheal button. So with the tracheal button, you start with 2 hours a day. Once they're tolerated for 2 hours, you can increase to 4 hours. Once they're tolerated 4 hours, you can increase to 8. And once they're tolerated for 3 days, they're ready for decannulation. So before I decannulate, I'm gonna do trach change. Shelby, will you help me with trach change real quick? So I'm gonna have someone help me. It's a 2-person job. So I'm gonna have her decannulate, and I'm gonna reinsert the new trach. So I'm gonna have her go ahead and do that. Are you ready? Mm-hmm.
Yes, sir.
All right, you ready? Mm-hmm. 1, 2, 3. And then you just resecure the tube. fits on there, and then you'll also replace the gauze. This holder is not wanting to hold, so I'm going to switch to a different one. Make sure you just keep a hand on the trach so that it doesn't accidentally decannulate. Alright, so once the patient is ready to wean, or once they are ready to decannulate after you've done the whole weaning process, like I showed earlier with the fenestrated tube, the tracheal button, and the speaking valve, you're ready to decannulate. So the first thing I'm going to do is I'm going to make sure I have everything ready. So I'm going to have gauze to cover the stoma as well as to clean it. So the first thing I'm going to do is have that ready, and I'm going to go ahead and get ready to decannulate. So I'm going to remove the tube holder. And then remove the gauze and explain to the patient what's happening. So to decannulate, you're going to have the patient take a deep breath and cough. So on the count of 3, cough, 1, 2, 3, and you pull it out. And then you're going to use the gauze with sterile water and hydrogen peroxide to clean around the stoma, and then the swab to make sure you get right up next to where you need to get. And then you're going to take a gauze folded into 4, like this, and then just tape it over the stoma. I don't have any tape with me right now, but you just tape it over the stoma, and once everything is done with that, you're going to do the stoma care as I showed with the sterile water and hydrogen peroxide on gauze and on the swabs. And you make sure you instruct the patient that when they're talking or coughing, they support the gauze. That's it.